IPM's Functional Restoration Program, or FRP for short, is a multidisciplinary program designed to increase physical function, improve pain coping skills, and promote the return to a productive lifestyle. Our goal is to teach you how to better understand your pain and learn how it affects your mind and body. FRP will give you the life skills and information needed to live a productive life despite your chronic pain.
Hi there, I'm Dr. Peter Bacci, and I'm part of IPM, and I've been involved in the FRP programs for 20 years. It's my 20th year doing this, and it's what I'm passionate about. One of the things I like to ask patients when I do one of my talks with them is, why do we have an FRP? Why are you here? Why are we here? Why do we do this? And the underlying answer that I believe in is that this is here for you to have a good life. You can have a challenging pain problem, all kinds of difficulties with that, and at the end of the day, you can still have an awesome, great life with chronic pain, and that's what we're here for, and that's what this is all about.
My name is Sarah Guzet. I am a clinical psychologist. I specialize in the treatment of chronic pain. I am also the program director of the Functional Restoration Program. The FRP is unique in how it treats chronic pain. It is an interdisciplinary treatment that incorporates all the different components of treatment into one, where you get a compound benefit. So you're not focusing on just the physical therapy or the education, but rather reinforcing it and teaching it to patients so that they can understand their pain better, how it affects their body and their brain, and what they can do about it. And that's where the power really lies, is that we're empowering patients again. So often with chronic pain, patients will tell me, my pain dictates my life. It's controlling how little I sleep. It's affecting my relationships. It's affecting my hobbies, which I no longer engage in. It affects everything. It's not limited to a body part. Most of our patients have been in chronic pain for years. And at that point, they've tried a lot and they're really discouraged. And so this program is unique in that we meet the patient where they are. And we start slowly building up their confidence and understanding, and we move at a pace that is safe. Because one of the concerns too is, well, I haven't been able to do this, or I use a walker or a cane. I don't know how I can possibly do exercise. And we'll show them that you can still be functional.
My name is Mary Jo Power, and my injury happened December 26th. I was working after Christmas in 2018, and luckily I work in a hospital, so when I fell, everyone was right there. I got really good care, so that part was great. When it kind of fell apart was working with workers' comp, and not only being injured, not being able to walk, having people take care of me, that was extremely difficult. Feeling stupid, what I had done, just all those feelings that were just making me feel worse and worse inside, as well as just dealing with the injury.
My name is Tanya Hunter. I'm a county employee. I got into a car accident a couple of years ago. I injured my shoulder and my back. Prior to FRP, I had lots of therapy. I had chiropractor, acupuncture, and I would seem to progress a little bit, and then I would feel like I would go backwards. And I couldn't really understand why I wasn't getting well. I was doing the things that I was told to do, but I still continued to struggle with pain. Finally, I was able to get into the FRP program, and it just seemed to be very helpful for me. It taught me, it didn't really take away the pain, but it taught me how to manage the pain. It taught me how to work through it.
So the beginning of the Functional Restoration Program, day one, I knew I could get comfortable with it. I'm not a big group person. Crowds make me a little nervous, and I've never been very good at asking for help. This was an opportunity for someone to stand up and say, you don't have to ask, just come, and then we'll work with you from day one.
I'm Erin Hernandez. I am a physical therapist in the Orange County Santa Ana Clinic, and I work a lot with the FRP groups. Basically, when a patient starts with FRP, a lot of times before that, it's been weeks, months, years maybe of not doing a regular routine. So oftentimes when they start is a bit of an adjustment. So my role at that point is to basically meet them exactly where they are. Everything that I start with, I'm really cognizant of the fact that this is all new. So nothing is, beyond what they can handle as a patient. It may be new. It may be, things that they've never done before, maybe ways to manage their pain that they've never thought of before. But, basically just meeting them exactly where they are and finding out what is really important to them, I think is what I start with as well. A lot of times we have a goal of going back to work, and maybe work is very meaningful, but maybe it's something different. Maybe it's something more personal. Maybe it's holding their grandchild or holding their baby, or playing with their kids, vacuuming their house. And so I really take into account of what is important.
Over the course of 8 weeks, the FRP program will help you better manage your pain and rehabilitate your mind and body. The program includes physical therapy, counseling, yoga and stress relief, movement and art, nutrition, medical checkups, career counseling, and workers' compensation guidance. Our graduates transition from a state of disability to one of functionability. Our goal is to help participants return to work, return to the life they knew, and rediscover a state of enhanced well-being that comes with being able to better manage their pain.
We give the patients information so they better understand their body and their pain, so that they understand what's happening. The majority of patients with chronic pain have some level of depression and or anxiety. How can you not? The idea of waking up and living with pain every day is pretty depressing on its own, but at a biological level, it affects your brain and the way that it fires. And once they start to understand that and realize, oh, it's not me, it's not a sign of weakness, not at all. It's your body doing the best it can, but it's being overwhelmed by these pain signals. And we teach them how to change their brain pathways, which is, I think, really cool. We can take a look at a functional MRI and see changes in a person's brain pathway. We didn't do brain surgery. We didn't touch you, but that was you changing your thoughts, you learning how to move differently, how to breathe, how to turn on your relaxation responses and get your body out of that fight and flight stress response. And that's really powerful. And it's a great thing to see.
One of the key things for me is just, the way that you think about it. Knowing that you will get through it, having confidence in the fact that you can do things that, for me, I kind of avoided, but I push knowing, okay, yes, this may hurt, but it's okay. You can push through it. You can still do things, and having the confidence that you could do it. Every day wasn't a great day, but I pushed through it. The things I learned, the breathing techniques, the daily exercise, why it was important, stretching, all of that was key.
There's a lot of avoidance when it comes to being in pain. Sometimes there's this feeling of I can't do something, and then so, once you have somebody there, my role is to make sure that they're safe. And I take that very seriously. So when you're in the clinic, even though these things may be, scary, my job is to make sure that you're safe in doing them. I've had patients that they, just standing or just walking for 2 minutes on a treadmill is more than enough. And that's where they start. And I've had that same patient, walk for 40 minutes. I had one a few months ago that left jogging and It was, incredible to see. And it's wonderful when it's in a group setting like it is, because all the patients have that shared experience of being in pain and being fearful of that movement that may cause pain. And when you have someone in the program really working so hard to reach their goals, it's almost infectious. Makes my job a little bit easier because they are motivating each other as well. And I'm just the cheerleader and egging them on and helping them throughout the way.
And to this day, I look back on what I learned during the time. Physical therapy was pointed toward us as our injury, but it also looked at us as a person. So we were exercising every part of our body, and we were on our own program. We didn't need to strain or stress. The instructors were wonderful. Wellness, which was a little new to me, as far as mindfulness and kind of going inside to just tame it all down. A lot of the education part was so important. It focused on how your body reacts to an injury and how it changes your brain. And that's what Dr. Abachi said to me at the first interview, was about a pain brain. And it was so important to know that this wasn't all me, that there was a reason that I was so crazy and depressed and upset, mad at myself, angry at the world. There was a reason for that. It's because my body had taken over and was taking care of itself.
On average, 75% of our patients are able to engage in a regular, structured, functional activity after graduation and will increase their physical activity by about 300%. Although our patients make great progress in 8 weeks with FRP, you're not done after graduation. Every graduate leaves with the tools and the skills to have a productive life and engage in regular activities.
We teach our patients so many different types of skills and techniques that we know it's not a one-size-fits-all. And so what we encourage our patients to do is to find the tools that work for them, and they'll keep those sharp, and those will be the ones that they'll reach for. It's okay if not every patient loves yoga. Maybe you'll learn some breathing techniques that you like out of yoga, but you prefer the stretching you learned in the physical therapy. That's fine, and you'll find a program that really works for you. A lot of patients will tell me, I'm not one for groups. I wouldn't either if they're strangers. But the truth of the matter is, you're gonna be in a room with others who understand what you're going through. They too have struggled with chronic pain for years. And pain is isolating. Naturally, because, when you're in pain, what do you want to go do? You go and lay down in a quiet room often and close the door, so you're isolating voluntarily. But also, it's isolating because often we don't feel like anybody else can understand what we're going through. And so to be in a room where other people get it is really beneficial. And the group support that people get, encouraging each other, and having conversations, having an open and honest dialogue can be really refreshing. And we find that to be so much more beneficial than if we were to do this alone.
There's really not a lot of programs out there like this. This is unique that it looks at the entire person, whether it's, you could be injured in one particular area, maybe a shoulder, or you could have multiple injuries. A lot of times you have pain in one area and it trickles down to other parts of the body over time. And this program really takes into account the whole person. And we truly do meet you exactly where you are. And there's a whole group of professionals who love this work and who just really want to see people just live a better quality of life. And we try to do, what we can to make that possible.
Well, definitely getting well's hard work. And I think part of the process is we come into this in a place of fear and pain, and we want to get to a place of faith where we know that the tools and things that we're learning will help us manage our pain, will help put it in a box and control that. And I think the process is building confidence every day in this FRP program, where you're learning new skills and practicing them over and over again each day, so we can get from a place of fear to faith in what we can do. And when people are able to do that, they're in control of their lives, they're in control of them, not the pain.
I knew my injury from a physical standpoint was what I needed to really concentrate on. And I knew that there was at least an aspect of this FRP that was going to do that for me. Little did I know that there was also a much larger and comprehensive emotional and mental aspect to this program that I think was more of a dictating standard to get me better. Because I knew that the physicality was what upset me, but I really had to get into my mind to find out what is the real underlying issue and how do I get comfortable with this? I'm a control freak. I fix things. For 20 years as a cop, that's what I was meant to do, is to fix things. And I'd gotten to a point in my life where I was no longer allowed to fix anything.
It's absolutely normal to have some reservations and some hesitations before actively engaging in a program like this. I respect that and we understand that. Something that I often point out to patients is that they've already exhausted all the tools they have. They've tried physical therapy, they've often tried things like chiropractor, acupuncture. They may have also tried home remedies and different routines, and it's not working. And it's okay to try something new. And no one is forced to be here. You're not forced into a commitment. But I often encourage my patients to come in with a little bit of an open mind. You're gonna hear a lot of new information, and to try to take it in and see what works for them. Oftentimes, once patients come into the program and give it a few days, they'll often tell me, all my fears have subsided.
I knew that this was going to be a forever thing for me. And by the time I was finished with this program, I realized they weren't kidding about, we're going to give you tools to deal with chronic pain. We're not going to tell you that we're going to make the pain go away. We're not going to tell you that it's going to go away. We're not going to tell you that you're not okay because you're at a certain level of pain. That was huge. Realizing throughout the program that I was getting better. But it was a very, very eclectic mix of staff members driving hard to help you reach a goal, and then being there right beside you if and when you needed to fall. And quite often they would foresee those moments for you. Hey, you might be pushing a little too hard, and here are some possible outcomes. And it may have been pushing hard physically, it may have been pushing hard emotionally, mentally. They were always there to watch and see if you veered a little bit, or if you needed to fall, or if you just needed a shoulder to lean on. I didn't expect that. I really didn't.
I would tell them to definitely try it. Don't knock it till you try it. Definitely try it. You will feel better. You will learn a lot, and it will improve your life. It will improve your life. Use all the tools that you're taught, implement them, and you will feel better. Yeah, you may have bad days, but you'll have more good than bad. That's what I would tell them.
We can't promise any cures, and no one can make your pain completely go away. But we can definitely make a difference in helping you live a fulfilling life. For more information on joining an FRP program, please talk to your IPM care provider.